You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane in Australia. This is the Dental Zone. Thank you so much for joining the show. In this episode, I'm going to continue on our journey with how to improve your oral health to have better overall health and what you can do to have a really healthy mouth for life. If you'd like to know more about what holistic dentistry is and how that relates to you, you can hop on over to holisticdentistry.au or over to my dental practice website, evolvedental.com.au. Now, I've been talking a lot about tooth decay and gum disease, what causes that, what you can do to prevent it, how you can help yourself to have much better dental health. And today's episode, I'm going to talk about looking inside your mouth. Not me as your dentist, but you looking inside your mouth and checking your own mouth to see what's going on. Because I can bet you most people don't look inside their mouth beyond doing that little kind of snarly smile, licking their tongue across their front teeth and checking they haven't got any food caught. But I want you to have a proper look to get an understanding of what's really going on in there so that when you're working with your dentist or your dental hygienist, it's a team effort. You get to point out things to them, they get to point out things to you, and then you can monitor that at home. So let's get into it. Let's get in the zone. So let's start by talking about your oral self-exam. You need to understand health before you can understand disease. So first I'm going to describe the look, feel and smell of healthy gums. After that, I'm going to tell you how to spot the signs of gum disease and how you can use your own method for looking inside your mouth and doing your own kind of mini checkup. Then I'm going to get you to examine your teeth, and we're also going to have a little look beyond the teeth and have a look at your tongues, your glands and the saliva. Now, this is optional. You don't have to do the self-exam, but by examining your own mouth before you're professionally examined and before you begin your new hygiene program, you'll get an invaluable baseline picture. You've got your own visual reference point from which you can monitor your progress. So I'm going to encourage you to write down the results of your self-exam, take those to your dental office, and then you can talk to your dentist and your hygienist about that, and you can compare what you found with what they found. And then if you repeat your home exam after spending 2 to 3 or 4 weeks being really dedicated with your oral hygiene and your home care program, you'll see for yourself what you can accomplish and how much you can do through your own efforts. Ideally, at this point, your dentist or your hygienist will have performed some hygiene therapy, provided support and guidance, and given you your personalised instructions. But we're not the one who brushes, flosses, and cleans in between the teeth for you. Your progress and how things respond to treatment is down to you. Your progress is going to be your progress. And by being able to see it for yourself and see what's happening, that improvements, those changes can be very motivating and very self-empowering. Now, if you're one of the millions who don't regularly see a dentist, this episode's really important for you. Far too many people believe that if they don't have pain, they don't have a problem. Now, how many people have heart attacks and believe that they're fit and healthy? Because before their heart attack, they didn't have any pain. Yet that whole time, there was inflammation, there was plaque buildup in their arteries were clogging, and then eventually a piece breaks off and it blocks their heart and they have a heart attack. Now, this is kind of the worst approach you can take for your health and particularly for your teeth, because by ignoring things and thinking because it's not painful, everything's okay, it's actually going to end up causing you much suffering and expense. So, examining your mouth, probably for the first time, will give you a chance to see what's going on in there, what really is happening in your mouth. It's one thing to hear the dentist or me on these podcasts or on my videos talk about things like plaque, decay, and gum disease. And it's another thing to actually see these processes in action and what's actually going on in your own mouth. You still might not want to do anything about it, but you're no longer ignorant and you can't use ignorance as an excuse. You can, however, use what you see to motivate you and not only get involved with your hygiene care, but also to take action to get your mouth repaired, to get it healed and get it healthy again. Don't worry about missing something because your home exam is going to be double checked by your hygienist or your dentist. We'll make the official diagnosis for you. Remember, no matter how well you do on your own, you need to work in partnership with your dentist and the hygienist, not only to verify what you've seen, but to pick up things that you may have missed and things that you will have missed because you can't do the diagnostic tests that we can do, and you probably can't see as well as we can in some areas of your mouth. But I feel pretty confident that when you do your self-exam, you will see quite a few things that you'll be able to point out, and you're going to see things you've never seen before. So I'm going to get you to get some things that you're going to need to do your self-exam. There's some basic tools that are very simple and easy to use. So you can get a little pen flashlight or torch, as we call them in English. You'll need a mouth mirror. Now you can get these online or you can get them from your pharmacy or drugstore, and you need your bathroom mirror. You'll need an absorbent cloth or some gauze to be able to dry your teeth and gums. You need somewhere to prop up your list of what you're looking for, whether that be written down or on your phone. You need a diagram of the teeth, and I will ask you to go look up online just something with pictures of teeth and the tooth numbering. And in America, the tooth numbering, they go from top right and they count round 1, 2, 3, 4, 5, 6, 7, 8, 9, all the way round to number 32 if you've got your full teeth. Everywhere else we chart them differently. So top right is quadrant or quarter number 1, top left is number 2, bottom left is number 3 and number 4. And then we count backwards towards the middle. So your middle tooth is number 1, and then 2, 3, 4, 5, 6, 7, 8, with 8 being your wisdom teeth. And then we go number 1. So your wisdom tooth in the top right would be called 1, 8. Your middle front tooth would be called 1, 1. So there's a little bit of dentistry for you. So you can look up those teeth charts or teeth pictures online, get yourself one of those. And then the best way to perform the exam is with a combination of the mouth mirror and the little pen torch, flashlight, and then the mirror in your bathroom as well. If you don't have one, then do buy one, or you can get creative and maybe you could use that with your phone. But the way I want you to actually do it is to get your little mouth mirror and tape the small pen-light torch onto the handle of the mirror with the bulb facing at the mirror head. Position it about maybe 3 or 4 centimetres, 1.5 inches away from the mirror, and secure that by taping it in a couple of places. And now you've got a really good hygiene tool with a light on that you can use to examine your mouth. So the best way to do this is you hold the mirror and the torch together, or you can do it separately if you don't want to tape it. So you use mouth mirror in one hand and the little flashlight in the other. You place the mirror in your mouth and you position it to reflect the area you want to see and shine the light on the area. You need to make little adjustments until you can see the mouth mirror then reflected in your bathroom mirror. Although the mirror light combination is easier to use, you're going to need a little bit of trial and error to get the results. If the mirror fogs up, it's because the mirror's colder than your breath. Basically, just run the mirror under some warm water for a few seconds, or you can put it in your mouth and rub it alongside the inside of your cheek just to warm it up. And that saliva layer will actually help to prevent the mirror from fogging up. So before you begin the actual exam, I'd like you to get a feel for the procedure. So we're going to practice just viewing your gums. It's a really simple technique, and after you've run through it once, you'll be a pro and you'll be really ready to start your home exam. Not going to be looking for anything specific at this point. We'll use the same approach later when we examine your teeth. So you can just switch the word teeth out for gums and vice versa. If you've got kids, this is a really great way to introduce them to their mouths. So get your equipment ready, wash your hands, get yourself in front of the mirror, and then when you're ready, you can start the exam. So let's look at viewing the gums around the front teeth. You don't need the mouth mirror for this part of the examination. If you need glasses to see, then I suggest you put those on as well, by the way. So you're going to lean over as close to the mirror as necessary to get yourself a good view. Place your index and middle fingers of each hand at the corner of each side of your lips and gently pry them apart. Your mouth and lips are very sensitive and delicate, so be gentle. Only separate your lips as much as you need to be able to see. Keep your teeth together, just barely touching. Move your lower jaw forward so your front teeth are even with the upper front teeth. So you're kind of biting on the tips of your front teeth. You should be able to then see enough of your gums around the front teeth to do your exam. If you want to view the gums around the back teeth, you've got two jaws to examine. So pick which one you want to do first. If you choose the lower jaw, then what you want to do is the gums around the outside of the lower left back teeth can be seen by taking your left index finger and pulling your lower lip out and down. So you pull it to the side, so you pull it out and then down slightly. Then you're going to insert the mouth mirror and you're going to face the mirror towards the teeth. So you're putting that between your cheek and gums, and then you'll reverse the procedure when you do the right side. You'll have to play with the position of the mouth mirror a little bit so that you can get that reflection in the bathroom mirror. Then to see the gums on the inside of the lower jaw, on the tongue side, you only have to open wide enough to place the mirror between the tongue and the teeth. If the tongue fights back, because it can be a bit rebellious and pushy, you can hold the mouth mirror to hold it back. Tilt the mirror as much as you need to be able to see your gums in the bathroom mirror again. Play with it until you feel comfortable. Be sure that you're going to need to periodically rinse the mouth mirror off and just warm it up with warm water again if it fogs up. To do the top jaw, the basics are the same. As long as you know what you're looking for, you have some patience and you use your mirror in the right way, it's going to be a breeze. Now, you're going to probably feel a little bit frustrated at first, but just practice those basics of pulling the lips out, having a look in the mirror, using the hand mirror and doing the little tilt so that you can see yourself reflected in the bathroom mirror. And then I'll move on to how you look at your gums and what healthy gums look like and what unhealthy gums look like, so you know what you're looking for. So you need to know what healthy gums look like. And this is important because if you don't know what health looks like, then how do you know you've got disease? And how do you know what it is that we are looking for when we're examining your mouth? These are what we use to determine visually, do these gums appear healthy? And then we do other cross checks to back up what we're seeing and what's being represented in your mouth. So don't panic If when you look around your mouth, you don't see all these signs of health, or you see areas that don't look healthy and some that do. We're going to get onto that. So healthy gums are firmed. They look like they've got active wear on, really tight fitting tights, following every little curve and nuance. Things in terms of like really toned, buff muscles. Those gums are going to look tight and taut. Healthy gums are generally a light pinkish colour. Some might even look whitish pink. For the lower jaw, this colour should extend down about 1 centimetre from the highest point that the gum reaches on your tooth, and then just flip that around on the upper jaw. However, if you are olive or dark skinned, you will have healthy gums with dark pigmentation, and even if you're fair skinned, you can sometimes have little coloured areas like freckles just on your skin. The point is, if your gums are darkly pigmented, then the remaining features check out okay, then your gums are healthy. Healthy gums fill in the spaces between the teeth. At the highest point between the teeth, they should form a little peak, like an upside down V. So that little pointy bit of your gum should fit in between the space of the teeth. Healthy gums form a collar, like a little rim around the teeth, and this is nothing more than a roll of gum tissue that starts where your gum meets the tooth. It rises up and blends back into the tooth. Healthy gums have little dot-like indentations called stippling. This stippling effect begins just below the collar, so just at the gum line, and it should look a little bit like the skin of an orange. Healthy gums are not tender. This means they don't bleed when you eat or brush. And finally, healthy gums don't smell. They're odorless. No morning, noon, or evening breath. I'm not talking about obvious bad breath, meaning that you've got, an obvious cause like garlic or onions or smoking, but your gums should not stink. Unhealthy gums smell, healthy gums don't. So what are you looking like with unhealthy gums? Well, now you know what healthy gums look and feel like, and you're becoming more familiar with your mouth, which you probably haven't given much attention to in the past. Then you need to see what is going on with your gums. Now, these are some of the things that you should look for when you're examining them. So if your gums are red, if they're swollen, if they don't fill the space between the tooth, if they've receded, if they're not sitting tight, if there's no stippling, then those are all signs that your gums are probably not healthy. And then let's do like a little questionnaire. Let me ask you some questions to help you determine whether you've got some problems with your gums or not. And then you can sort of have a look and see where that's happening in your mouth. So are your gums shiny and smooth and without any stippling? Are your gums swollen, puffy, red and angry? Do the tips of your gums, where the gums fit between the teeth, have a crater-like or hollowed out appearance? Is there any whitish, pus-like substance at the tips of your gums? Is food easily caught between your teeth? Do your gums bleed when brushed, when eating or any other time? A good way to check for this is you just push on the gums slightly with your finger in between the teeth and you'll see whether they bleed or not. Do you have bad breath? Are your gums painful? Have the gums receded? Do you have any loose teeth or teeth that have shifted from their original position? Is there any plaque or tartar stuck to your teeth? This is commonly seen at the gum line. If you check these and you have them, have you also noticed that maybe you've got a slight fever a sore throat, loss of energy, or just generally that you're feeling flat? If you can say yes to any of these questions and note where it is in your mouth, then you've got a pretty good idea of what's going on, that you've got some form of gum disease, that you've got symptoms that would point to the fact that your gums aren't healthy. And the extent and seriousness of your gum disease can vary from area to area. You may only have the beginnings of a problem in one place, and you may have advanced disease in another. So you want to check out your gums around every tooth, inside and out, and not just around the front teeth. And then when you've done that, you're going to have a pretty good idea of the general condition of your gums. You're never going to really know the full extent, and that's where we come in as your dental professionals, where we can do our visuals, we can do our measurements, and we can take x-rays, and then we can help diagnose exactly what's going on, where it's going on, and the best way to treat your gum health for you, and then how you can then support yourself with your oral care at home. So we've looked at your gums. Now let's have a look at your teeth. Now you're going to use the same tools and the same techniques. You can start the examination anywhere you want, but make sure you start and end in the same place. Be methodical, work your way around. Now, I don't want you to brush your teeth before you're examining them. You're not showing off. You're not trying to make up for lack of time and, oh my God, I'm going to see the dentist. I'm going to brush my teeth like mad kind of thing. Yes, I know you all do it. Now, examine your teeth. I want you to cover all the following areas. If you think you have a problem, then note it down right where it is. Note the number of the tooth according to the numbering plan you're using, and actually make a note of when you've done this, like the date. First of all, you want to see how many teeth you've got. Everyone should, in theory, have 32 teeth if you count the wisdom teeth. If you don't have wisdom teeth or they've been removed, then you need to have 28 teeth. Are you missing any teeth? And if so, which ones? Have the teeth adjacent to the missing tooth or teeth moved, tipped, or rotated? If you have a missing tooth, has the tooth that is opposite it, so if it's a bottom tooth, it's the top tooth, has it moved and dropped and moved into the void? You can check this by closing your mouth as you would normally, and then with your fingers, hold your lips back and see if the tooth above or below the missing one has moved into the empty space. You can use your mirror to do that. If the tooth has moved, your situation is quite serious. Some of the tooth may have to be removed or crowned if we're trying to make room for a replacement tooth. But whether it's moved or not, you'll have to replace the missing tooth, or you'll probably end up losing the opposing tooth. Whenever you lose a tooth, the opposing tooth no longer functions while you're chewing, and in effect you lose them both. If you keep your lower teeth but lose your uppers, you'll lose the function of all of your teeth because the bottom teeth can't function properly without the top ones. Now we're going to have a look at the shape and size. Now there's a wide variety of shapes and sizes found in nature, and the same is going to happen with your teeth. So-called perfect mouths only happen in about 2% of the population. A tooth that is misshapen, too small or too large will usually not be a problem for your dental health. As far as cosmetics or the aesthetic looks are concerned, however, that may cause a problem for you. And cosmetic dentistry can do absolute wonders to correct a problem tooth. So if you've got a tooth you don't like the look of, its size, its shape, its colour, then note that down and we'll look at whether that's a candidate for some cosmetic dentistry. Now, let's have a look at the spaces between your teeth. There are natural and unnatural spaces found between the teeth. Most natural ones aren't going to cause a problem. They're usually wide enough so that most food won't get stuck in between them. And other than your own feelings about them aesthetically, there's nothing to be concerned about. In children's teeth, in their baby teeth, you want spacing. because this means there's going to be room for their proper teeth. If your child's baby teeth are all lined up perfectly and they're touching, they're going to get crowding with their adult teeth. They are meant to have spacing between their baby teeth. Anyway, let's go back to your teeth. Unnatural spaces are another problem. These spaces I'm talking about are not caused by tooth loss. They're spaces where you get food jammed. So you can eat sort of fibrous foods or stringy foods like meat, oranges, popcorn, and you're going to always get that something stuck between your teeth feeling, and you can't get in there, and even good brushing doesn't remove it. If that's happening, you've located an unnatural space. It may feel like the food is stuck in the gums or wedged between the two teeth. In the dental profession, this place where two teeth are meant to touch is called a contact point. And if you've got a bad contact or a poor contact, they're not as tight as they should be, and this will cause food impaction. This can be caused by decay, a broken filling, a poorly shaped or placed filling, and this can cause a serious problem with your gums and cause you to have higher risk of decay. Food that gets stuck can't be removed by brushing, and these areas are very susceptible to gum disease and tooth decay, and they must be fixed. Until it's fixed, make sure you floss or use what we call an interdental brush in between your teeth. So do you have any unnatural spaces? Note the location. Do you have overlapped, crowded or rotated teeth? So if only 2% of the population have perfectly straight teeth, that means 98% of us have a chance of at least having one tooth that isn't in good alignment. Lost teeth are the most common cause of problems with crowding and rotation. Teeth that are too far out of normal alignment can cause the following problems. If your teeth are crowded and overlapped, they're more difficult to keep clean. You're going to have interference with your bite and normal chewing. They can cause temporomandibular joint problems, TMJ for short. They can be unsightly, and it means that you're more prone to tooth decay and gum disease because you can't keep the area clean. You're more prone to a tooth cracking, chipping, and fracturing because it's out of a line and you're not biting on it properly. If you can't afford it, there's much more that can be done through if you can afford it, then orthodontic treatment, braces to correct the position of the teeth is the way to go. If you can't afford it, then we've got to teach you how to properly take care of those overlapped, crowded or rotated teeth. Do you have any teeth that aren't properly aligned? Have a look and make a note, and you're going to need to know where they are because you're going to need to spend extra time keeping them clean and healthy. Now, have you got any bite or TMJ problems? There are a high number of people, whether they're aware of it or not, who have at least some problems resulting from malocclusion or bad bite. Bite problems can range from minor ones involving improperly placed filling, where it's a bit high, a bit proud, and that's easily corrected, to those who have lost their teeth, to those who have got crowding and jaw misalignment involving most or if not all of your teeth. Is your bite even? A simple way to test this is to swallow and then immediately lightly tap your teeth together. It should sound as if the tap-tap or the clunk-clunk is evenly distributed. And if that happens, then you're fine. You can also use your mouth mirror to check this. Bite down, insert the mouth mirror, pull your lips apart, and see if your teeth fit together like interlocking fingers. The pointy bits should go into the dippy bits, and they should fit really nicely together like a jigsaw puzzle. Bite down slowly with no food in your mouth. Are you hitting on one side of your jaws before the other? Relax your jaw muscles as much as possible. Swallow and your teeth will come together naturally. Don't try to guide your lower jaw close. Think about something else so your mind doesn't get you too busy and involved, and let your mouth close naturally, and then just have a look Closing slowly, does it feel as if you're hitting on just one tooth or a filling first? This may be quite subtle, so pay attention. You may notice that instead of hitting evenly on all the teeth surfaces at once, you first hit on one tooth and then you have to kind of slide to get your teeth into place. Do your teeth or some of them feel sore for no apparent reason? And are they tender after chewing, or are they tender when you wake on a morning? If you have difficulty opening your jaw fully, this can be an indication of TMJ disorder. This disorder can have pain and discomfort in the jaw joint, and it affects millions of people. It's caused by prolonged tooth clenching or grinding during your sleep, a bad bite, injury to the joint, the ligaments or the muscle of the joints, degeneration of the bone in the jaw joint. It can be caused by wisdom tooth impaction or extraction. And if you have any of these following symptoms, you probably have a TMJ issue. Are the muscles in the general area where the lower jaw hinges with the upper jaw sore, tired, or tense? Can you hear cracking, clicking, or popping sounds when you open your mouth to talk, yawn, or chew? Does your lower jaw slide outside of its socket, or almost when you open wide, almost like you're dislocating your jaw? Check the tops of your teeth. Are there any wear spots either on your fillings or on your natural tooth surfaces? If you've got metal fillings, the amalgam ones, which we're going to talk about in other episodes, high spots will often feel quite shiny, or the filling can look worn and your tooth can look chipped and broken down. If you're wearing the tops of your teeth down, then you've got a serious problem. If you've got any suspicions that you've got TMJ problems, that will need to be verified with your dentist. Most of these bite problems begin as simple ones and just become more complex through neglect. They can cause nutritional problems because you don't chew properly, or they force you to a softer, more processed diet. And it can also lead to severe bone loss because of the uneven forces and unnatural weighting. If the problem is caught early enough, it can be corrected, but don't let the problem become so serious, because we may not be able to offer you a simple and inexpensive solution. And you could end up paying an unnecessary price for delaying intervention. Serious bite and TMJ problems are among the least understood aspects of dentistry. It has to be determined that you have a condition, so you need to ask your dentist to review that, and we may have to refer you to a TMJ specialist. Let's have a look at staining and discoloration. It's easy, if you don't know what you're looking for, to confuse stain with decay, but most stains have an external cause, and a lot of staining is just generally harmless, even though it doesn't look nice. You can also mistake a stain for the discoloration caused by an amalgam metal filling, which can darken the surrounding tooth structure. Normally, routine hygiene therapy will remove self-imposed stains, but if any stain remains after cleaning, the dentist will need to check that out. Stains come in all colours and can be caused by many things, most of which aren't good for you. So let's look at natural discoloration. Most teeth start out bluish white when you're young and get yellow to greyish yellow as you get older. So if you used to have white teeth when you were young and they're yellow now, don't panic. That is part of aging. Yes, your teeth get darker and your hair goes white. It sucks. The white part of your teeth, the enamel, gets worn away with age, and because it's transparent, the more enamel is worn off, the more yellow coloured from the dentine found directly under the enamel shows through. This is a normal process unless you wear your enamel off too rapidly. For example, if you're 30 and your teeth were white 1 month and then they're yellow the next, then you've got a problem. Rapidly wearing of the enamel can be caused by Over abrasive diet, a highly acidic mouth and acidic diet, so lemon juice, drinking acidic soft drinks, and using abrasive or acidic toothpaste. Bicarb of soda I like because it's alkaline, but scrubbing your teeth with it, it's a little bit too abrasive. It's like putting sandpaper on them. So, have you observed that your teeth are yellowing too fast? If so, we need to determine the cause, and we need to have a look at what's going on there. Green stains. Yes, green teeth. Green stains are most often found on children's teeth, usually at the point where the teeth and gums meet, and more obviously on the front teeth. This is actually the membrane that covers the erupting tooth. And then during the eruption process, it will remove itself. If it isn't, a simple clean and polish with the dentist should remove it. Brown stains. Brown stains are caused by smoking or tobacco. It can be caused by drinking tea or coffee. But the major contributor to brown stains is poor oral hygiene. These substances, the dark foods, the tea and coffee, will stain the biofilm, the plaque, and the calculus, the tartar on your teeth. Many people think their teeth are stained when it's actually the plaque and the tartar that is stained. Look closely. Do you have any brown stains on your teeth, particularly on the portion nearest the gum lines? Do you have any dark grey, yellow, brown, or black stains? These are discolorations that you should look for. They usually indicate that the nerve, which is called the pulp that contains the nerves and blood vessels, is dying or has died. It can be a result of decay. It can be from a trauma or a blow to the tooth. You don't have to bump your teeth that hard to kill them or damage them. It's quite worrying. And what happens is if you hit the tooth in the right direction, it causes the blood vessels inside the tooth to bleed out and hemorrhage, and the blood leaks into the pulp cavity and into the tooth. The resulting darkness in the tooth shows through, and there you have a discoloured tooth. It may not show immediately, so if you fell off your horse last week or hit the edge of the swimming pool, got hit in the mouth playing sport, and then forgot about it after the pain all went away, and you now have a discoloured tooth, you can put two and two together. Have any of your teeth become discoloured over a short period of time? Look for white or brown chalky spots. An excessive intake of fluoride during the formation of the crowns of your teeth can cause discolorations. Although this is somewhat unsightly, we don't tend to find decay in these areas. Decay. Well, we've already talked about decay and where it's found, where it's most commonly found. And if you can't remember, then you can go back and listen to the episode on tooth decay. So when you examine your teeth, you want to look around the gum line. You want to look at the roots if you've got recession. You want to look on the bite surfaces and try and look, where the teeth contact against each other. Do you see anything that looks like decay? Do you see any holes? Do you see any cracks? Do you see any broken bits, which I will come to? Excuse me. Do you have any broken or lost fillings? All restorations, all fillings will wear down over time. They can fracture and they can fall out. It's a harsh environment and things don't last forever in there. Check around the edges of your fillings. Check around, see if the things are intact, especially those on your chewing surface. Do you have any worn, broken down or missing fillings? Now we're going to look at broken and chipped and cracked teeth. These are easy to find. If you see a tooth that doesn't normal, check its twin on the opposite side of your mouth. If it doesn't match, you've got something broken or missing, and you need to make a note of that tooth. Teeth can break and chip without giving pain. So unless you examine your teeth, it may go unnoticed. Look especially hard at the front teeth and any teeth that you've had any sensitivity to hot, cold, acid or sugar. And these may be areas where you've got something broken or missing. So do you have any broken or chipped teeth? If so, note down where they are. Cracks and fractures are often too small to see with the naked eye. It's much easier to spot them if you dry your teeth before you start looking. Most often, a crack in a tooth will be noticed more by feeling than by sight. If you wake up early and you're sucking kind of cold air over the tooth and that feels a bit ow, then you may have a crack. If you eat something sugary and you get a little pain or a twinge, that can indicate that you've got a crack. Make note of it and, let the dentist know. Have you experienced any pain or sensitivity on a tooth that shows no other signs of disease? Then we look for erosion and abrasion. These terms simply mean that your teeth are being abnormally worn by various substances that probably have no business being in your mouth in the first place. Erosion and abrasion are easier to feel than they are to see. Often when we start exploring around with our probe and we touch one of these abraded or eroded areas, you immediately feel a sensation that feels like having a little shock go through your teeth. And if that happens, tell us, because if we don't know that you're actually having some discomfort there, we don't have the information that we need. Erosion is abnormal wear due to chemical reactions. So this can be because of acid like lemon juice, citrus fruits, and that acid is strong enough to dissolve the tooth's enamel and dentine given a long enough period of time. And this happens fast in your mouth if you suck on lemons. You're one of those people who has lemon juice every morning and then goes brushes your teeth. You're eroding your enamel with the acidity. Abrasion is often from scrubbing your teeth too hard, using a abrasive toothpaste like bicarb, and using a really hard toothbrush. So soft brush, please, guys. Then have your gums receded, showing more of the tooth than before, even though your gums look healthy. That can happen where acid is eating away the tooth and chemically detaching the ligaments that connect the gum to the tooth. If you have exposed roots, you're going to be more vulnerable to both erosion and abrasion, so make sure you check out those areas. Are your teeth sensitive to hot, cold, or sweets, or brushing at the gum line? Make a note of that, because again, that indicates erosion and abrasion. If you can't break the lemon drinking habit, then please just have it through a straw and then rinse your mouth with water straight away afterwards. And the same for other acidic substances like vinegars and soft drinks. The phosphoric acid in soft drink is strong enough to dissolve an iron nail. So your teeth have got no chance. You know what my thoughts are on soft drink? Yep, don't have it. If you combine that soft drink acid with 5 teaspoons of sugar that you find in a normal standard soft drink, you have got enough to cause erosion and decay. Soft drinks and sweets have probably decayed more teeth than all other foods and drinks combined. So if you drank a lot of soft drinks and ate a lot of sweets and then sucked on lemons, oh my goodness, your teeth don't stand a chance. Now, sensitivity stemming from erosion can be corrected by simply finding and eliminating the cause. There are special kinds of toothpaste that can treat these, desensitizers and remineralizers. But if the problem's gone too far, we may have to pour a professional desensitizer on, or we may have to put a coating filling over that sensitive area as a last resort. Abrasion is like erosion. The tooth is being worn away, but this time it's mechanical and not chemical. Abrasive sandpaper rubbing on soft wood wears the wood away very quickly. And the same goes for your teeth. I'm not saying you should be sandpapering or even thinking that you might be, but the rate of wear on your teeth will depend on the hardness of your enamel and how abrasive the material is and how often you use it. The end results look very similar to erosion. So it's the same signs and symptoms: sensitivity, and a peeling away of the gums. An abrasion is caused because of the following: brushing the wrong way. If you use a side-to-side motion instead of an up and down sort of rotary motion, then you will wear your teeth. The teeth look like they have been sandblasted or chopped away with an axe. And the effects of wrong way brushing will be compounded if you use an abrasive toothbrush, a hard bristle brush, abrasive toothpaste, and you brush too often with a lot of force. So, as I said, nice and gentle. Toothpicks. When a toothpick is pushed in and out of the spaces between the teeth, it not only pushes the gum downward and away from the tooth, but it also acts like a piece of sandpaper on the thin part of the enamel near the gum line. Eventually, this toothpicking will push the gum down past where it normally attaches, and it will begin to erode the root, and you can have toothpick craters. And if you have any bone loss, the process gets accelerated. As well as being unsightly and increasing tooth sensitivity, these craters are food traps. And if you use toothpicks correctly, they can be an effective tool, but I personally don't like them for the reasons I've just explained, and I'd rather you use a proper interdental brush that is designed for cleaning the area. Then there are things like chewing your fingernails, biting on pens. These things will chip and break your teeth. They will wear notches in your front teeth. They can set up fracture lines in the tooth, and it can crack your teeth. So these are what we call parafunctional habits, things that you shouldn't be doing. So we encourage you to stop them. Now, if you like nuts and seeds, then don't be cracking them open with your teeth. Use a nutcracker. Otherwise, you're going to end up breaking your teeth. I'm also going to tell you not to be biting off threads or ripping open packets with your teeth. That's what scissors are for. Clenching and bruxism. Severe clenching and bruxism, which is nighttime clenching and grinding, can actually flex the tooth at the junction where the enamel meets the tooth, and this can cause sensitivity. So are the tops of your teeth excessively worn? Are your chewing muscles sore? Do you have pain in your jaw joints? And if the answer is yes, then please tell us, because then we can check you for TMJ problems. I want to take you now beyond your gums and your teeth, and I want you to look at your tongue. You should only have one, hopefully. At your tongue, your glands, and your saliva. Because no self-exam is going to be complete without looking at the other sides of the mouth. When I do a comprehensive check, the first thing I do is check the lips, the inside of the lips, the roof of the mouth, the cheeks, the tongue, the floor of the mouth, side of the tongue, and the back of your throat. I then have a look at your saliva flow. I have a look at your bite, your jaw joint function. I have a look at your gum health, your oral hygiene. I do gum measurements. Then I check the teeth visually. Then we take photographs and we take x-rays. So we check everything. So let's have a look at what's going on in your mouth and see what's normal and what's not normal and what seems suspicious, because one of the things we look for is mouth cancer. I don't want to scare you, but mouth cancer is serious. It needs to be detected early. The prevalence of it is increasing, and we are finding it at younger ages. It's now not just a problem that affects our older generation. It's no longer just smokers. It's no longer heavy drinkers. HPV causes mouth cancers. We are seeing it in younger and younger patients. So it's super important that we check everything out. So here we go. Your tongue. You might think that your tongue is just there for sticking out, having a French kiss, or licking around your teeth, licking your lips and so forth. Well, yes, it does those things, but it's actually a very interesting organ of your body. It's made up of a lot of muscles. It's very, very strong. It's super important for swallowing, breathing, airway protection, and talking. So let's examine your tongue. Get out a piece of clean cloth or a little gauze, stick out your tongue and fold the cloth over the protruding tip and hold it out. Hold on to the tongue, be firm but gentle. It's a slippery little bugger and it doesn't like leaving its dent. The gauze or the cloth will help keep it trained and in line. If you're a person with a strong gag reflex, you might be able to hold onto it, but give it a try. Remember, it's an organ that normally acts on its own. While you have your tongue out, examine the following characteristics. Have a look at its size and shape. This is very varied from individual to individual. And tongues are a little bit unique, like your fingerprints. I've never seen two tongues that look the same. It has a unique ability to change its size and shape. It can grow or shrink depending on conditions. For example, if you lost your teeth and you didn't have them replaced, the tongue will grow larger and spread to try and fill all the new available place. It's so adaptable that when you get your teeth replaced, it will eventually shrink back to the size that nature gave it in the first place. And this can just take a few months to happen. The shape of your tongue is a reflection of your jaws and your genetic heritage. So let's have a look at the colour of it and the coating. Another aspect of the tongue is that, it does have different colours, it can have different textures. There are all these theories that when you look at the tongue, it tells you about your digestion and your health and so on and so forth. I think that it can tell you about the health and well-being of your body, and there are things that your tongue will tell you that we can pick up on. The colour and the thickness of the coating on your tongue will vary from day to day, and it can range from a fiery reddish purple to a calm and healthy looking pink or light red to a pasty white and grey. You can have a mixture of reddish colour and pasty coating. The most important thing is to know that a healthy tongue has no lumps or bumps, no open sores, no ulcers, abnormal swellings, major discoloration or pain. So what does your tongue do for you? Well, it's a fascinating muscle organ that's absolutely necessary for the functions that I've talked about that we'll often take for granted, like speaking, breathing, swallowing. But it's especially important for maintaining your oral health. So your tongue contains most of your taste buds, and if you keep it clean, your food tastes better. Your sense of taste is reduced if your tongue's heavily coated, and then that means that people tend to want to put salt and spices and seasonings on everything. Your tongue is invaluable for talking. Try holding it still and talking and you just can't do it. It moves food around your mouth as you're chewing. It mixes and shifts the food from one side of the jaw to the other, and it helps you produce good chewing ability. Just let your tongue do its thing. It knows what to do. It's the main mover of food to the back of the throat so that it can be swallowed. It's a very sensual part of our body. I won't get into that. We're not, we want to keep this clean and PG. It helps to fight decay. When you're chewing or talking or just having fun, your tongue helps clean your teeth and massage your gums. You can consciously take advantage of this ability by moving it around the teeth and gums, especially when you find it impossible to brush and floss or rinse straight after eating. Tongues are great. The salivary glands. Do you even know what they do or where they're located? Well, if you don't, you're not alone. Most people don't. I didn't until I went to dental school. You don't have to be a student of them, but I want you to know some things about them. There are 4 major saliva glands in the mouth. 2 mandibular ones, which are found directly under your tongue behind your lower front teeth. If you stuck your index finger over your lower front teeth and pushed it down and back just a little till you feel soft skin to the area where your tongue is attached, that is where your saliva glands are and where they open out. The other 2 glands are opened in the cheeks, 1 on each side, directly opposite the last 2 or 3 upper back teeth, and those are your maxillary saliva glands, and they're harder to see. You might see 2 little sac-like projections in that area where you found them, and it's nice to know that even if you can't find them, that they're there and working for you. These spit glands are very sensitive. If they become bruised or damaged in any way, they can become very tender and even painful. The area around an irritated gland will feel as though you have a small piece of leather hanging there. The lower gland is particularly susceptible, so be careful when you brush this area or if you're biting on hard substances with your front teeth. You don't want to damage those glands. Do you have any tenderness around the glands? You can sometimes, although it's quite rare, get plugged salivary glands. So you can get saliva stones, and you get these little stone-like objects that are caused by mineralization of the saliva or by disease. They're a little bit like gallstones or kidney stones, and they grow in size and they block the opening into the mouth, and then the saliva trapped in the gland will swell up. If this happens, you will both see and feel it, and it can become painful. It can happen with no pain, and it can happen in any of the glands. And if you do think you've got this, then you need to see the dentist or the oral surgeon. Saliva. Now, the consistency of your saliva will vary from one person to another, and it will vary for you at one time of day for the other. It can range from a light, watery consistency to a heavy, ropey, mucus consistency, changing with the conditions of you and your mouth. If you are dehydrated, then your saliva flow is reduced and it's going to be thicker than normal, and that reflects an increased need for liquids. Saliva will be reduced if you're nervous, angry, or afraid. And the best indicator of general health and the most effective decay fighting saliva is the watery kind. Check the consistency of your saliva. Is it thick or syrupy? Do you have a hard time spitting? Or is it dry or foamy and seem as though you don't have enough? Why is saliva important? Well, it lubricates your mouth, allows you to swallow your food, and then without saliva, you're not going to be able to get the food down your throat. It acts as a chemical buffer. It has ability to neutralize things that end up in the mouth that may be too acidic or too alkaline. Particularly crucial for neutralizing acid produced by the decay-causing bacteria. If the saliva is too thick, it can't penetrate the germ-filled plaque. Saliva helps disinfect your mouth. It can help heal small wounds and cuts inside the mouth. And along with the acid buffers, it contains minerals, enzymes, germ-fighting cells, and other things that help keep your mouth in balance. Except for, a few really blessed people, nothing is perfect, and this is the case here with saliva. And there's ways it can do harm. Well, if saliva is high in minerals, this is a good thing, but if you leave plaque around for too long, those minerals are going to calcify the plaque and turn it into calculus or tartar. The second problem is if you don't have enough saliva, you get a condition called xerostomia, which is about having dry mouth. Now, this can happen because of medications that you're on. It can happen because of disease, and we do get less saliva production with aging. If you experience dry mouth, then again, you need to make sure you tell your dentist. The healthier you are, the healthier your saliva is going to be. So make sure you drink a lot of water, cut down on your consumption of alcoholic drinks because alcohol is a diuretic and causes dehydration, and the same will be true for coffee. Let's look at other diseases of your mouth. So dental disease is the most prevalent oral disease. It's tooth decay and gum disease, but you can get types of cancers, you can get growths, you can have abnormal skin conditions that involve the mouth. Oral cancer is going up in its diagnosis, in its prevalence. If it's caught early, the 5-year survival rate is 90%. If it's not, it drops below 50%, and many people die unnecessarily because of mouth cancer. So prevention is the key. You can, eliminate your tooth and your gum disease. You can have your therapy visits, and then we can get things back on track. You can see then the dentist regularly and make sure you're seeing the hygienist regularly. I want you to have your own periodic exam and then back that up with your dental exam. But one of the things you've got to get checked regularly is your mouth for oral cancer. If you don't have regular exams and you don't examine yourself, then how are you going to examine yourself for oral cancer? What do you know to look for? Even we as dentists can sometimes find it difficult. We have diagnostic tools now that can support us. And if we see anything we're unsure of, we're going to get you straight on for a specialist, get a biopsy and check everything else. Most reason that oral cancers are difficult to detect early are most people don't have regular exams and most people don't examine themselves. If you see something in your mouth that you are unsure of, don't ever hold back from mentioning it or pointing it out, something that you think might be abnormal, and then, don't sit there not saying anything because you don't want to look silly or have us think that you're just, a bit over the top. We need to know these things. Has there been any changes in your mouth? I'd like to know. We like you to get your oral cavity checked for disease at least, with the dentist twice a year. But I want you to be checking at least once a month. Just look around, make sure if you see anything that looks different or doesn't look normal, then you need to let us know. If something strange has appeared with no obvious cause and it doesn't disappear within a week or two, then you need to book an appointment. Look for ulcers. Ulceration is redness or a sore spot on the lips or tongue or inside the mouth. And if it doesn't heal itself within 2 weeks, that can be an indication of something serious. Have you got any swelling of the lips or gums or any other areas of your mouth, face or neck? Have you got white scaly areas inside your mouth? Is there recurrent bleeding with no apparent cause? Have you got any loss of sensation or numbness in part of your tongue, lips or mouth? Have you got persistent coughing or difficulty in swallowing or speaking? Because people aren't aware of just how many kinds of cancers and other diseases are found in the mouth or show signs or symptoms there, I'm just going to give a bit of a list. And this should make it dramatically apparent that dental disease isn't the only thing we're looking for when we're checking in your mouth. We look for abnormal bone growth, abnormal soft tissue growth. We can pick up things like AIDS, canker sores, drug reactions, epilepsy, fibromas. You can see hairy tongues, hemangiomas, which are like birth marks. We can pick up things like haemophilia, herpes, Kaposi's sarcoma, leukemia, leukoplakia, malignant melanoma, myoblastoma, nutritional deficiencies, papillomas, skin disorders, squamous cell carcinomas, syphilis, thrush, TB, signs of diabetes. There are so many things that we can pick up by looking inside your mouth. So it's something really important to think about. Now, I'm not here to teach you what those things are or how to diagnose or treat any of these diseases I've just mentioned, but I want to mention it so that you understand that your mouth is actually an area that can signal that there are things going wrong elsewhere in your body, as well as with your teeth and gums. So I want you to get used to looking at your mouth. Have a look around and look, just check your gums, see if they're pink and flat, whether there's any redness, bleeding, swelling, recession, peeling away, staining, discoloration, chips, broken teeth, and then you have an idea of what is healthy and what isn't healthy. And then when you come and see us for your dental appointments, we work together as a team. So you can say to me, oh, my gum seems a bit red up here. Can you check that for me? And I go, certainly. I'm going to check that. We'll talk about it. We'll talk about what it is, why it's there, and how you can manage it. And then that way, you're not oblivious when you come to the dentist. I see so many patients, particularly new ones. Any concerns or worries with your teeth, mouth, or gums? No. I just want to check up, everything's fine. And I look around, they've got rampant gum disease, they've got broken teeth, they've got tooth decay, they've got all sorts of things going on, and yet because they don't have pain, or they don't understand that their symptoms like bleeding gums, sore gums, wiggly teeth, and all those sorts of things that we've talked about are actually a problem, they think everything's fine, and then I have to tell them everything's not. And you can see we're not on the same page. So if you understand how to look around your mouth, how to spot things that don't look normal, then when you come to the dentist and I go to, you've got a broken tooth back there, you go, yeah, I thought so. Then we're on the same page and we're working together as a team. Well, I hope you found this useful, or you probably think I'm completely mental. And yes, I'm obsessed with your teeth, mouth and gums because it's my job. But, you can look at your hands and you can go, yep, my hands look normal and healthy. You can see a lump or bump come up on your body and you know that that wasn't there before because you're used to visually examining these areas. But we don't do that for our mouth. How often do you look inside there when it's so simple to do? So I'm going to encourage you to do your mouth check, to do that monthly, to just have a little look around, see how things are going. And then if there's anything of concern, come and see us. Well, thank you so much for joining me. This is The Dental Zone. I'm Dr. Rachel Hall, holistic dentist. If you want to know more about the health of your mouth, teeth and gums, hop on over to evolvedental.com.au. If you want to know more about holistic dentistry, catch up with the podcasts, you can go over to holisticdentistry.au. You can listen to us on, your usual podcast channels. Thank you so much for supporting me. Thank you for joining me. Do share this with your friends and family. If you want to come and see me, you can give my clinic a call, 0737201811 or info@holisticdentistry.au, and I'll be super happy to see you and help take care of you. And until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.